a group of Eastern Cape healthcare workers have been sleeping outside the offices of the National Health Department in Pretoria since Monday. The nurses who were hired to take care of COVID-19 patients say they've been poorly treated by government. Malungelo Booi is our senior reporter who joins us now live from Pretoria this morning. Malu, it's the third year under COVID-19. We talked about schools going back for another year under the pandemic. One can just imagine the challenges faced by the healthcare sector. But what's specific to this group of healthcare workers from the Eastern Cape?
Well, Michelle, these healthcare workers were the ones that were hired, in fact, in 2019, when the country really was starting to see COVID-19 cases. Now, they're saying that they feel like government is pushing them away. So they're in the East, they're from the Eastern Cape in various parts of that province. As you would know, that the Eastern Cape is actually quite vast. So there have been protests in various parts of that provinces by some of these healthcare workers. So this group has then decided that they will take their plight to the national offices of the health department, exactly where we are. So you can sort of like see some of their belongings. Some of them have actually been sleeping here since arriving from the Eastern Cape on Monday. Let's bring then one of them into the conversation so that they can explain really why they decided to take this route. Malungelo Booi, thank you so much for your time. Say the Eastern Cape is far from Pretoria. This is actually something that must be bothering you, that you've decided to come this far.
Yes, this is a very, very serious problem that has brought us here. Our contracts have been terminated. And as we speak right now, we are out of jobs. Our contracts were terminated on the 31st of December. So we have now decided to come here to bring this problem to the National Department of Health.
What do you want them to do? What are you saying to them?
We want the National Department of Health to solve the problems of the Eastern Cape. We want them to intervene on the problems of the Eastern Cape. Mainly, without wasting no time, mainly the 34 billion loss on medical legal claims. In fact, the 34 billion that has been accumulated on medical legal claims. Yeah. We want the National Department of Health to solve to intervene on the 3.4 billion, which is being shedded annually to cover the 34 billion.
How will that, though, do you think that's the reason why your contracts were terminated? Because the Eastern Cape Health Department doesn't have money. We all know this.
That is mainly the reason why our contracts were not extended. Yeah. We know very well that there is 8,399 of us. And it takes about 940 million to cover the pays, the salaries of all these healthcare workers. Therefore, we feel that if they were not losing 3.4 billion, at least they would be able to pay, to employ or to retain these workers.
There were promises made I've been made to believe that there was a promise that was made to some of these healthcare workers that you will be brought into the system or you'll be absorbed, and that has not happened, right?
Yes, there were promises, actually. When we had the meeting with the Premier of the Eastern Cape on the 16th of March last year, we had a meeting after they had a protest in Bishop. Yeah. We then ended up in a meeting in East London with the Premier, with the MEC Health and MEC Finance. They did show commitment that they want to retain us. But because they do not have money, they cannot carry on with that commitment.
So what do you hope? Then if the Eastern Cape Health Department has already said that they don't have money, so what's the point?
Well, that is not the end of the world. If they do not have the money, that is not the end of the world. We must remember that in the State of the Nation address, the President stated that defeating coronavirus pandemic is a priority. Yeah. That was the President in his State of the Nation address last year. Now we fail to understand why it is now not a priority. Okay. Because if it is a priority, it should come first. The President, the national, must be the people. We cannot say that there is no money. Okay. If there is no money, then the country is giving up.
Quickly, do you feel let down?
we do feel let down.
Yeah.
We do feel betrayed by the president, in fact, by the nation, by the National Department of Health. That's how we feel.
Okay, thank you so much for your time. All right, Michelle. So we'll interact with as many of those that are here protesting from the Eastern Cape, really. It's very far from where we are, but they're saying that they're hoping that somebody from the health department here will essentially come and listen to their cries, and they're saying that they feel betrayed and they feel let down. As you and I would know, Michelle, that the Eastern Cape at some point was the epicenter of COVID-19.
Absolutely, Malungelo Booi. Still massive challenges in that particular sector in healthcare. His live to us there in Pretoria.